Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever. Whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.
Hello, everyone. I'm Barbara Hamley. At one point, the advice was pretty straightforward. Certain vaccines for children at certain ages to prevent childhood diseases like measles, mumps, and rubella. Flu shots and COVID shots were readily available to all at your local pharmacy. Now there is confusion. Are vaccines safe? Do they cause autism in children? Do you need a prescription in order to get a COVID shot? And can Americans trust the federal government to give them sound, science-based facts so informed decisions can be made? The confusion surrounding vaccines. That's next on Another View, right after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Hamley. Before we get started, of course, I have to tell you about something important happening in the community, the Virginia Williams High School Career Association. Now, that's a 501c3 nonprofit charitable organization, and they're hosting a financial literacy workshop for high school students, grades 9 through 12. That is the time to teach them, trust me. It is on Saturday, October the 18th, from noon until 2 p.m. at Green Run High School, which is on Dahlia Road Drive in Virginia Beach. Now, the interactive workshop will talk about budgeting, building good credit, the importance of saving and investing, and what's involved with the NIL, the name, image, and likeness. And it is going to be facilitated by Erica Moore, who is National Vice President for Five Rings Financial and the Vice Chair of the Board of the Northern Virginia Black Chamber of Commerce. It is free. It is open to high school students, grades 9 through 12. You must register. Go to V as in Victor, WHSCA.org. That's VWHSCA.org and register your student for this free financial literacy workshop. Hope to see you there. So later on in Another View today, we're going to be talking with our favorite jazz musician, Jay Sennett, and he's going to tell us about the upcoming Phoebus Jazz Festival. But first, it's Another View on Health, featuring cardiologist Dr. Keith Newby. Dr. Newby is also the Market Director, Community Health Improvement and Engagement with Bon Secours Mercy Health. He has the longest title on the planet. And hi,
man,
Keith.
I get dogged out every time I come here about my title.
Because every time I have to go online and look it up again because I can never remember
You're
it.
supposed to remember this stuff by heart.
Absolutely. Okay, before we get started, we're talking about vaccines. Got to ask you, you have 2 months left?
Yes, 2 months. November 23rd, I am done.
You are done. Is that graduation day?
Well, that's actually when the semester is over with.
Okay.
And, of course, you know, I'm overachiever, so you know my grades are always high because I accept no less than perfection in anything I do. So,
Absolutely.
November 23rd, now the graduation date is like mid-December. But, once them final grades are in, I am done.
November 23rd. So,
November
Lisa,
23rd.
I think that's probably around the time of Another View on Health, right? So we may or may not see you, right? Is that what you're telling me?
You won't bring me in just so we congratulate me.
Well, absolutely. We're going to have a party. Absolutely.
I look forward to it.
But isn't it ironic that you're studying public health in light of this topic and this thing about vaccines?
Well, this is why I feel like I'm at least suited to talk about it. And it's kind of interesting. We'll get into this as we go along, but we do need to talk about the internet and when people are getting their information and what that means. But I think just being able to go through this and to really have a real discussion about vaccines and their importance, understanding what they do. And I think sometimes people I'm not sure they really understand what a vaccine truly is. I mean, they kind of know what they think they've heard, but to know what it really is, how it works, what it's supposed to do, limitations. I mean, that's something I think we need to go through.
Okay, let me throw out the phone number right now. If you have questions about vaccines, whether or not you should get a vaccine, the number is 757-440-2665 or 1-800-940-2240. Let's talk about then, Keith, exactly what is a vaccine?
So you really think about it. What a vaccine is a way to prevent or to attempt to reduce disease and infection. So essentially what you do is you think about it. How does the immune system work? Immune system works by identifying an infection or some source that has potential to cause infection and elicit an antibody response to fight it. So, when you're looking at, and then back in the day when we had some of the older vaccines before the mRNA came out, they used to take like a denatured infective source, and they would find a way to kind of create a medicine, inject it in you, and what your body recognized that as foreign. And
so it was a dead cell. It was the disease, but it was dead.
Right.
Okay.
Yeah. So denatured, they call it.
Denatured.
And your body would figure out, say, okay, this is foreign, so I need to develop some kind of immune response to it. And I akin it to, say, like an example, if you're going to fight a battle and you have armies on both sides, how many soldiers you have can also dictate how likely you are to win. So if you think about somebody who's never been infected, because a lot of people say, oh, I exercise every day, my immune system is fine. I say it may be fine, it may be in tune, but if your body's never seen this particular virus or whatever that bacterial infections or whatever, it may not be able to respond fast enough to do, because if it's never seen it, it's not going to know what to do with it. That's why you have booster shots, and we'll get into that in a second. So the vaccine is designed to, say, okay, it's kind of gives you like a memory, so your body remembers and has enough soldiers to try to fight this battle. So the thing people used to say about with COVID vaccines, they say, okay, people get a COVID vaccine, I still got COVID anyway. And I'm like, yeah, but this is the thing. If you have chronic medical conditions, your immune system is not as attuned as it needs to be because you're not as healthy as you would need to be or should be. So it may not respond as fast, but because it has seen it before, it says, okay, I do have a small army already built, and it can start building that army again quickly. So it's designed to say, okay, you come in, some infection hits you, or whatever the source is. What can cause infections if it overtakes your immune system and it can't, it multiplies faster than your immune system can fight it off. So that's when people get infection. Now, if you already have some antibodies there and it just has to rev back up, you may still get an infection, but it won't be as bad because your body has attuned it. And those soldiers kick out to try to kind of contain that virus or whatever this is trying to fight. So I tell people all the time, don't think it's not designed. It's like a program. It's not designed to just prevent, because it can't do that. It can prevent,
but it's not designed to actually do that.
Your health impacts your body's ability to respond.
Right.
If you've not lived a great life and you haven't done any of the things you're supposed to do, you never go to the doctor, and you got all kinds of medical conditions, your body may not respond as fast. So you may still get it.
Because it's busy trying to take care of those other things that have gone on.
So a lot of times I tell people, listen, look at it as part of a program. You need to be in shape. You need to eat right. You need to live right. I said, and that will help you respond faster, which may actually prevent it. But you can't substitute it. You can't substitute the vaccine. I mean, you can try, but it doesn't work half the time. I mean, like I say, I told people all the time, I took 5-6 COVID shots. I mean, I COVIDed it out, but but I knew I had to be done. And that booster comes in because as time goes on, your antibodies wane. So it has to remember. So it's just like, think about if you work out. You work out every day, you're going to be tuned up. But if you stop working out, and you say you wait 6 months, you're going to lose somebody. Yeah, you got to start over again. So this is kind of the similar kind of scenario. The body has to be reintroduced. It says, okay, I know I need to fight this. And then, viruses mutate. And because they mutate, whatever that vaccine was hitting at first, viruses are smart. They know how to get around. They know how to get around
that army.
And that's why you have to get booster shots. And that's why they changed the flu shot. Every year they're saying what is going to be the predominant strain. And they develop the flu shot based on the look of the predominant strain.
So when it comes to children and babies, they're born, once they've been born, they no longer have their mother's immune system to protect them.
Correct.
So that's the reason why young children need to get vaccines.
Exactly.
Right?
Exactly. So when you think about, a lot of this stuff, you have to look at it from a perspective of what's going to be most important for them, and that's kind of where we run into an issue, because you think about vaccines, like like the Tdap, diphtheria, tetanus, pertussis, measles, mumps, rubella, chickenpox, polio, there was a H influenza A and the human papilloma, hepatitis A, hepatitis B. All these have potential to create some major problems. When I see a parent say, okay, I don't want my child to get vaccinated, and I mean, I'm not a pediatrician, so I don't involve in that, but if they share anything with me, first thing I ask them about is understand we all got vaccinated when we were children, and I didn't have any issues, and nobody I knew had any issues with the vaccine. It's been proven. I don't care what rhetoric you're hearing now. There's so much false information out here now, and people come up with these interesting notions about what's right and what's wrong and what's real and what's not. The problem is and I tell people all the time, understand you need to have a trusted source that you can go. Don't go to the internet to get your medical information, and please don't go to TikTok. I had somebody the other day told me, oh, I went on TikTok because I need to find out about this particular illness. I said, are you kidding me? Wow. I said, did you listen to the name of the program? Are you kidding me? That's what you're going to put your trust in?
And put your life in.
Oh, so I tell people all the time, I say, listen, like say diphtheria, breathing problems, heart failure, paralysis, brain damage, with measles, mumps, rubella. We got this measles outbreak now because the measles was eradicated at one point in time. Now it's not, because people are avoiding vaccines because they're worried about stuff, and we get into what they're worried about. But, you think about what the disease could cause. To me, when you weigh it out, I'm all a risk-benefit ratio kind of person. Pneumonia, encephalitis, deafness, infertility, birth defects. You look at varicella, severe skin infection, pneumonia, encephalitis for that, paralysis for polio, long-term disability. You have all these major medical conditions that can happen as a result of not getting vaccinated and contracting that particular illness.
Because I've heard parents say, I don't want my child to get all these shots. It's too painful to get these shots. But when you're talking about these things,
I said, which is more painful, a 2-second shot or a lifelong problem? Because you cannot predict if somebody gets encephalitis. Nobody's going to know what the residual might be. You may get through an encephalitis and be totally fine, but I've had plenty of patients develop encephalitis that's still not back to normal years later.
And encephalitis is swelling of the brain,
swelling
right?
of the brain. Was an infection of the brain, and it causes swelling. And so, you think about that short and long-term risk. The biggest thing I try to get people to do, I said, try your best not to look at, people always tell me, I do my own research. I'm like, but you don't know anything about medicine. And that's not a slight. I look at it like nobody's going to come to me for financial advice on what stock to put in. Right. I mean, I thought I was a relatively smart guy, but I know my limitations. I didn't train in finance. That's not what your training is in. Exactly. It took 17 years for me to be a cardiologist. 17. I've been in practice for a while. I'm not going to say how long it's been, but we'll say it's been a minute. So those years of exposure of constant, looking at medical conditions, seeing the aftermath. I think I have a little bit more experience than somebody who's spent 5 minutes reading something and going to make a determination, especially given the false information that's out here.
So why now, especially this whole thing about autism and the connection? What is it that people are thinking is causing this? First of all, it's not causal.
No,
correct.
No, there's no data that says it's causal. I had to fight with somebody the other day about that. Well, I read on the internet such and such. I said, I don't care what you read. I said, I can tell you what's facts. I said, you have to go on facts and figures. The downside about the internet is that's a totally unregulated source of information. I could put anything on it. I could put anything on the internet I want to. Anything. There's nobody's going to stop me from doing it. I have seen falsified studies, meaning they got it all. I mean, they have an article up there that looks well written, but then when you try to look at it as a source, you can't find it anywhere because it's fake. So the thing is, I tell people, you have to really have a trusted medical source that you can depend on to help guide you, because if you're trying to let your understanding do it, you may get in trouble.
Yeah.
And you don't want to do that, because you may make a decision you can't get out of. That's the biggest thing. Those decisions you make can affect not just you, but your family. But the thing I tell people is, remember COVID, when everybody didn't want to take the COVID shot.
Yeah, because they said it was too fast.
But I asked them, I said, well, define what's too fast. What makes that the case? Is that something you've heard, or do you know that for a fact? I said, how long do you want them to take? 10 years when everybody's dying? I said, think about what's the process, and really there was a lot of red tape in the FDA that really created the delay, for something to come out. It's not the research, it's the process, that they wait you through, because you may have to wait months before you even got up to a board to say it's approved or not.
So when you have someone such as the President of the United States telling women to tough it out and don't take Tylenol, if they can absolutely avoid it and so forth, he's a trusted source for a lot of people.
Shouldn't be. Because same thing I would tell you, and that's not a slight on anybody. I would say that to me, if you ask me about pregnancy, I delivered some children when I was in medical school. I delivered a couple in residency. That's it. So I'm not going to be the one. I know my limitations.
You would tell people to go to an obstetrician or gynecologist.
Exactly. I mean, you have to understand your limitations. You're talking about a non-medical person that's giving you medical advice. And I say that about anybody. I got patients that say, "Oh, my cousin told me don't do this." I'm like, "Who's your cousin?" And that's not. Again, these aren't slights. It's you have to understand the advice you give can affect somebody for a lifetime. And I don't see there's no causal relationship between autism and Tylenol. And this is the thing I tell people.
Well, not only that, but just to interrupt for just a second, the study that they keep quoting was of 12 people, and it was completely debunked.
See,
and since 1999.
Yeah, this is the issue with that. Even with the vaccine stuff and autism, and I got into a debate with a patient's wife the other day about this, and I told her, because she was, "Oh, I read this." I said, "Listen, this is the thing." I said, the first thing is when you talk about in science, you have to look at the scientific method. How do you prove something? In order to really truly prove that there was a causal relationship between Tylenol and autism, you would have to have a double-blind, placebo-controlled clinical trial comparing Tylenol and placebo. So you have to power that study with enough patients to show a statistical difference to say, yes, there's a correlation. That has never been done. You can go back and I can go get some data from some Hochspoken place, and I can get all their data, and I can start looking at correlations, and I can see, and that's like a cholesterol pills, like the statins, and they got dementia. That didn't come from like a prospective study. That was a retrospective view where they'd look, and the study wasn't even designed to look at that. It was doing something else. And they'd say, okay, well, let's look at this data and see what else we can see. But the problem is, if the study wasn't designed for that question being answered, you can say there's correlations, but you can't say there's a causal effect. And they have not done that. You would have to do that even with vaccines. I say, to me, to prove to me as a medical professional that there's a causal relationship, I need you to do a study, vaccines, placebo, and enough patients in it to do it. And then let's see who gets autism and who does not. Because if you even look at what we talked about prior to the autism rates, which I thought was higher than what I would have thought.
Yeah, the president said that it was one in 12 boys are diagnosed with autism, when apparently there's an estimated 1 in 31 children in the U.S. who are diagnosed with autism. So
now let's take that part, because even though that sounds like a big number when you really think about it, but let's talk about what's the prevalence. Who's getting autism? The prevalence of this varies by race and ethnicity. with the highest rates among American Indian, Alaska Native, Asian Pacific Islander, and Black children. That's where the highest prevalence is.
Highest prevalence of
So
autism is.
you think about, so then the question becomes, and it's not like majority of Black people are taking Tylenol. I mean, everybody's taking Tylenol. So the question becomes is, what are the factors in those groups of individuals that's different from somebody else? And then you got to look at, the socioeconomic. Are these people living in areas where we don't know? They could be living in areas with toxins blowing all over the place. I mean, that's where the causal issue. It's easy to try to blame something, but the question is that really the cause?
Do you think it's such a concern too because we don't know yet what causes autism?
I think fear of the unknown is always a scary place. And so I don't dismiss that. It's just the question becomes when you start digging and really start looking into it, don't let the initial fear of things drive you to make decisions that may be not beneficial.
So, putting your public health hat back on again. So when you hear the head of health, Surgeon General, I think it was in Florida, saying no more mandated vaccines. And so, anybody in the state of Florida doesn't have to worry about if they don't want to take vaccines, they don't have to. But when you think about that and what could possibly happen across the country, if you go to one of the theme parks there, that's a petri dish, is it not?
Absolutely. But see, that's where I have my biggest concern, that I think if we are in a position, a government position, you have to ask yourself, would you compromise your belief system? Meaning we are trained as scientists. We work on facts and figures. We don't work on supposition. So would you sacrifice that for a job? I'm not going to do that. I'm not going to say something that's not true. I'm not going to go on some, host-spoken study that nobody knows anything about. My credibility is on the line. So, we as healthcare professionals should never, and in my opinion, we should never compromise science for, just because somebody gets pushed into saying something or doing something. I'm actually, because to be honest with you, I'm not even sure I want to listen to the CDC as much as I once did. That was our trusted source for advice.
And I was thinking about that as I was doing the research for today's show, because what did everybody do during COVID? You went to that CDC website to find out, how long do I have to quarantine? What do I need to do?
Exactly.
What are the steps? Where do I find the free test? I mean, everything was there. And it was trusted.
Yes,
and
absolutely.
People did that, and they got their shots. And while prior to the vaccine coming out, a lot of people passed away.
Exactly.
And that was scary. And I know you went through that because you provided shots for folks. But can we do that same type of trust today, going to that website?
Personally, I have doubts, about it. What I try to advise people now, I said, look at what would be a potential trusted source. I still trust the medical community, but in certain locations. I'm still down for the Johns Hopkins of the world, the Dukes of the world, the Harvards of the world. Because even with that stuff that they went through, they didn't want to compromise any of their principles of factual information, good health care delivery. So I would go to those sites before I'm going to go to the CDC. And I'm going to see, is there a correlation between the two?
So how are doctors feeling about having to defend their advice, basically?
Well, something, to be honest with you, we've always kind of had to do that anyway when you really think about it. My biggest fight is trying to get people to take a blood pressure pill when they have hypertension because they say, I feel fine, I should never have to do this stuff. So we always have to defend our position. But we always felt like we had a backup from, some other higher organization that would say, okay, we could refer to that as our proof. I'm not sure we can do that anymore. And that's okay, but we have to find out where we're going to get our proof from now. Who are we going to trust to say this is where we know we can depend on this information? I'm just not there with this current situation. I'm not feeling it, because I mean, for me, and even think about COVID during that time. Now we're in a different phase, but you think about COVID. I was around during the HIV issue in Atlanta, which was like the HIV capital of the world when I was an intern and a resident. But that didn't scare me because I knew how that was transmitted. Once we kind of had our factual data, because they had like these pneumocystis pneumonia, and they were getting Candida encephalitis and toxoplasmosis encephalitis. I mean, it was scary. You seen these people dying because we didn't have the drugs to fight that then. Mm-hmm. But we knew how it was transmitted, so we could depend on that, and that didn't scare me as much. But COVID was a whole different ball game because you could just get in a room with somebody for 2 seconds to get an infection.
And you had it.
So, but I tell you, when the vaccine came out, I remember when this was going through its phases in November, the end of November, I think it was 2021, maybe 2020, whatever it was. I know that's when it started to come out, but it wasn't in mass production yet.
Right.
December, I got my shot around Christmas time. Mm-hmm. But when it became kind of where everybody could get access to it more, it was around February.
Right.
And that's when I started doing it in the office, and we had a vaccine clinic. I saw a precipitous drop in admission rates at the hospital starting in April. A precipitous drop. I'm not talking about, for a while, I would have carrying 25, almost 30 people in the hospital.
Wow.
And at least 70% of them had COVID. It dropped from 25, for me personally, 25 to like 2 by May of that.
Once they got those shots.
And to me, it was a direct correlation of vaccinations and infection rates. I just want people to don't fall prey to rhetoric, fall prey to the science and understanding of what this is designed to do. And I think that would get us in a better place.
Yep. If you're just joining us, we're talking about confusion surrounding vaccines with Another View on Health co-host, cardiologist Dr. Keith Newby, who also serves as the Market Director, Community Health Improvement and Engagement with Bon Secours Mercy Health.
That long title.
Yes, that long title, 757-440-2665 or 1-800-940-2240. What questions do you have about vaccines? Have you made a change in, perhaps you got flu vaccines and COVID vaccines in the past, and now you're thinking maybe not so much? Give us a call. Let's talk about it. 757-440-2665 or 1-800-940-2240. So, Keith, I know we talk about telling people to talk to their medical professional and so forth, particularly for minority communities and those who already have healthcare disparities. If they can't get to their doctor, are there other health care people that they could trust to kind of guide them? Nurses, nurse practitioners, I don't know.
I'm almost like, I tell you, one of the things that you can always potentially do is, if most churches actually do have connections with healthcare people, and they may have healthcare people in their congregation. I'm a member of First Baptist Butte, so I'm the resident physician there, but I do that because I love my God. B, I love my population of people, so anything I can do to help, I will do. Most churches will have the ability to get you information if that's what you need, but I always say you can still look at your local health departments. The biggest fear I have, and I would actually potentially turn to the medical school here as well, potentially they have the ability to guide people as well. And so I think you look at Bon Secours, we can guide you, Centera can guide you. There are people that can help, at least give you advice and direct you to where you can get vaccinated if that's what you're trying to do. So I think that's, you want to just reach out to, at this point, I'm like, reach out to anybody, that you think could at least guide you to where to go. I'm not saying reach out for advice, just reach out to know where to go. And,
right.
Because that advice stuff can be really tricky, and I tell people all the time, don't do something or say something unless you'll be prepared to deal with it.
Let's talk to Herman in Matthews, Virginia. Hi, Herman. You're on the air.
Hey, how you doing?
All righty. What's your question, sir?
Well, it's not a question. It's just I have a comment, for you, and that is, after I got shot, I ended up with my stomach tore up for 8 months. I hate to put it this way, but I didn't have a solid bowel movement, in that whole time. And
what kind of shot are you talking about?
I'm talking about the COVID shot.
Okay. All right.
And when I got and I found out that my stomach was inflamed, and it was caused from this shot because I had never had any problems before. And I just, wanted to put that out there because, there are, pros and cons, but, when you got to go through something like that, that's just, that makes you not want to do it.
Well, that part that can be, I can understand that. The question that I would pose out is, and I tell people this all the time, if you look at statistically, the chances of that shot causing that stomach problem in a bunch of people is going to be rare. I gave over 5,000 COVID shots, and we had no complications at all.
Right.
So, statistically, that risk is low. The second thing is the question becomes was there already a stomach ime there, and did the COVID vaccine potentially just escalate it up? Or, because we don't know. That's the issue with like side effects, because things can happen coincidentally. I'm not dismissing that could be the case, but when you look at pound for pound, how many people actually have an 8 month, issue? It's rare. Extremely rare. And I didn't see it at all personally. So I'm looking at risk benefit. That's everything for me. It's about risk benefit ratio. What is riskier to do or not do?
Do you think sometimes because you're right that people, when they experience, that's their life experience. Yes. And I'm wondering, do we hear more from them than we hear from others who don't have an issue? Because if you don't have an issue, you're really not talking about it.
What I fault my community, medical community. I think during COVID, we did a poor job of really being out there to the level that the naysayers were out there. I think the naysayers had the mic. That's probably why I went to public health, because I'm like, we did not do it right. We didn't, but I hope we learn from those errors. As an example, the thing with the masks and the distance and all that. Well, there changes there. Y'all change it every 5 seconds. I'm like, okay. Now, personally, what I would have done, how I would have handled, but this is in retrospect, because when you're in the middle of stuff, it's hard to know.
Yeah.
But in retrospect, what I think it should have been was we say, okay, what we know today is this. But this is an ever-changing thing because we're still learning. So we may have to change our recommendations. But what we do know is the danger of this, and we are trying to come up with our new recommendations as fast as we get that information, and it may change. But that's changing because we don't want to keep the same information out that may not be true. So
the way that you present the information
it's going to
also
impact how you receive it.
Becomes an issue. Let's talk to LB in Virginia Beach. Hi, LB, you're on the air.
Hi, Miss Ann Lee. I enjoy your show.
Thank you.
I had a comment to make. I know that, everyone's saying something about President Trump putting out this message about the Tylenol. And, it's kind of like, listen to the message, don't shoot the messenger. But this has been an ongoing lawsuit in New York since 2022, a class action lawsuit over this Tylenol. And it's in appeals court right now. But I think it is interesting, whatever information is given out, to heed these things and, take warning about whatever it is and look into it more. And like I said, this has been around for a while. Back in 1994, when I was pregnant with my child, my OBGYN advised me not to take any Tylenol, no extra strength Tylenol, nothing like that. I'd had an injury, and that's the way I was relieving my pain. And he said, do not do that. And that was also because of the load on your kidneys when you're pregnant. And I don't know if your doctor that you're speaking to is the OBGYN, but I do know that that's what I advised and was advised, and that was a long time ago, 1994. So I was just interested in, have you all looked into any of these things with the class action lawsuits? Not only that.
According to, I just got a note from our producer, and according to article in the Washington Post, the lawsuit has been dismissed. So it's not viable.
It says it's in appeal right now. So
Okay, we'll do some more research to find out exactly what we can discover with that. But let me let Dr. Newby respond to you. And he is a cardiologist. He did say earlier he is not an OBGYN. But I will let him to respond to your comment. Thanks so much, LB, for the call.
So this is what my feeling is about this. And I want everybody to take this in a way that I can convey it. If you look at malpractice premiums, who pays the highest? OBGYN. Because of how people go after them if something goes wrong. So I'm not sure, and please take this in the right way, but I'm not sure that people advising you to suck it up and take the pain is based on true factual information, or people saying, listen, I'm not going to advise them to do anything because I'm not going to try to deal with what might happen. If something goes wrong, then I got to be up in court and defend myself. And unfortunately so, because we are in such a litigious society, people will advise. This is like when I deal with people with chest pain. The ER will bring you back. You want to admit everybody with chest pain because they don't want to deal with the liability. And it has nothing to do with whether they really think you have a heart issue or not. They're not willing to accept that liability. I've had people, I've done heart catheterizations on, cleanest coronaries in the world. They go home, come back the next week with chest pain, and they want to readmit them. I'm like, what are you readmitting them for? But it's really based on the fear of dealing with the aftermath. So, and Tylenol doesn't by definition affect the kidneys. It has potential to affect the liver in an overdose situation. So, the thing is, with these situations, that's why I say be careful what you read on the internet, because they may say appeals. Is it really an appeal, or is it just somebody posted that? I don't know.
Yeah, that's why we're looking for that information right now so we can bring that to the audience. Let's talk to Michelle in Norfolk. Hi, Michelle, you're on the air.
How you doing?
Okay. How are you?
I'm good. So my question or my point to the group is that I'm trying to figure out a way to deal with the frustration of getting a shot. So our family had prescriptions to get the new COVID vaccine, and we went to the pharmacy, and one of the pharmacists decided that they were the gatekeeper of who got the shot and who did not. And we had an immunocompromised person in the family. The doctor had said, yes, you need to go get the shot. And then the pharmacist was questioning it and trying to deny a family member the shot based on, you need to tell me what that thing is, that problem that you have. Well, no, because if a doctor sends a prescription for antibiotics to the pharmacy, does the pharmacist say, well, is this for an ear infection or is it for chlamydia? Well, none of your business.
Right.
I agree.
Actually, Michelle, I'm glad you brought this up, because that was going to be my next question to Keith about the availability of getting shots as we go along.
I agree with you 1,000%. And say, well, this is the only issue in the medical world. You have this new situation that's popped up that nobody knew they don't know what to deal with. Mm-hmm. So, and you have some, and I love my pharmacy pals, but every now and then you'll have somebody that wants to overstep, and try to act like they're doctors. I'm like, you're not a doctor, you're a pharmacist. Just like I'm not going to overstep and try to do your job. Don't overstep, try to do mine. That's the unfortunate reality. The best piece of advice I could tell you is, if you run to that situation, just say, give me my script back. Let me go to a different pharmacy, because everybody's not going to do that. Because most pharmacists, they just try to get their day done. They're not going to sit there and try to challenge, especially when you have documented evidence. But I think some of them are fearful because, am I going to get fired because I'm giving this COVID shot out? Because that's the only thing with this current situation is like these rules came out, but with no true understanding of, because this, we talked about this last night. Okay, if you say you have a chronic medical condition, I can go in there, pharmacy, and say I have hypertension.
Right.
So
I got to prove to you I have hypertension to get this? Or how am I going to prove I need a doctor to say he has hypertension? That's this. Because the rule right now is 65 and older, or if you have a chronic disease or
So then
compromised immune system.
So define chronic condition. What are we talking about? So that's what I'm saying. That's a vague term. And it really, there's no real reason to even, if somebody wants a COVID shot, I mean, we've already proven it's safe and effective, so why deny it? So that's that kind of thing that I really wish the government would let medicine, do government stuff. Now, there's going to be a little overlap. We know that, but that shouldn't be their call to say that, and to regulate that, especially when you have the medical community in unison.
Well, and the other part of it too is if you're going to make that type of rule, then make it clear so that everyone knows what to follow.
Well, but my thing is they shouldn't be making that rule at all. I mean, the advice should come from, people that know. I mean, and they could come up with a pound, but just don't be putting people on it just to, unfortunately, you'll say, okay, I only want you on this package. I know you're going to do what I want you to do. I mean, that shouldn't be the case either. Yeah. That should be a separate, if you want to do that, but you have no part in the selection of who gets put on this thing, and let the medical professionals do what they do best.
Do what they do best. Just to clarify, the 2022 lawsuit that our earlier caller referenced, she is correct. It is currently being appealed. So they are still trying to decide an answer.
Well, it's not so much they're trying. They already got the answer. They just didn't like the answer, so they want to try. So they want to do it again. That's what the appeal process is. They got denied, and they're trying to appeal it. And again, the downside with lawsuits is it just depends. There may be some legitimacy to it. It may not be. It may be. It's hard to say. It depends on who's the best lawyer on the team. Mm-hmm. So, but the bottom line is, Tylenol's been around forever. If you look at the majority of people that take Tylenol, I've not heard of any issue. And then the question becomes, and I can guarantee you this is the problem: how do you prove that Tylenol caused the issue? Because you think about it, it's not like that's the only thing you do. Now, if somebody puts you in a glass jar,
and the only thing you're taking is the Tylenol.
The only thing you had access to, you didn't have access to the air, you didn't have access to, food you eat, water to drink, and no environmental issues, and all you had was in a glass jar and Tylenol. And then now that's different because you eliminated all the other possibilities. But until you can eliminate them, there's still going to be room for doubt to say, is this in fact the cause of that problem? And that, I guarantee that's why they probably could not prove it beyond a reasonable doubt that this was the culprit problem. And that would be hard to do.
So we got 2 minutes left.
What is 2 minutes already?
I know. Can you believe it?
Oh, wow. That went by fast.
Because it did. Absolutely. So last minute advice, things that you want to encourage people to do, et cetera.
I would say, trusted source. Be careful what you read on the internet. Don't believe everything you see. You want to have.
And if you've come across something,
ask
see if you can find it elsewhere.
Exactly.
If
there are
see if
several.
it works.
I always went on the premise that if I see 2 studies done showing the same thing, that gives me a little bit of confidence. I say, okay, the design was probably appropriate. Mm-hmm. But I will look at the study to make sure I like what I saw. So I tell people, and then take it to your doctor. If you have questions, if you're not sure, don't just go on what you read, and don't feel that you have the ability to negotiate through medical information as a non-medical professional and be always accurate. Mm-hmm. That's not a dismiss to anybody's intelligence. It's being able to articulate and to understand what you're reading to know what you need to know about that piece of information. That's the issue. So if you have you need a trusted source that you can talk to, get trusted source, not just your brother or your cousin, but somebody in the medical field. Yeah, my brother would work. Absolutely.
He's a doctor too.
So, but that's just the thing, is just be careful. That's all I'm saying. If you choose to not give access, that's your choice. Just don't make a wrong choice based on bad information. That's my best piece of advice I could ever give you.
As always, Dr. Keith Newby, thank you so very, very much for keeping it real. We really appreciate that.
Not a problem.
And we will be right back. And welcome back. Jay Sennett has produced jazz programming for WHRV-FM for 32 years and counting, but that's not all he does. 35 years, excuse me. In addition to making albums and performing live across the globe, he also started a nonprofit called Hampton Roads Jazz with the mission of providing world-class jazz to the Hampton Roads audience as well as education about the musical genre. And Jay, what's happening this weekend in Phoebus? Are you tired, bro?
I am beat. We have the festival again this week, starting tomorrow night at the American Theater. 7:30 start time, a little earlier than last year. We're doing it 2 days now instead of 3 days. A lot of people lost a lot of money. Budget cuts. I mean, I'm going on that road, but it's 2 days. It's going to be 2 days of some jazz for everyone. We got something to tap into. Everyone. Tomorrow night, a group that appeared on last year's festival, the Latin Jazz Conspiracy. So many people ask me about this band. They're going to open it tomorrow night, backed by popular demand, right? and it's true though. And the headliner tomorrow night. Master drummer Steve Smith, and Steve Smith was part
We're
of.
listening to some of his music now.
Yeah, but see, what's interesting? He was in Journey. He was in the rock band Journey for 10 years. During their huge hit period. So he's on all those records. But Steve is really a fantastic jazz drummer, and so he's bringing his group in.
Are you gonna play with him?
No, I'm playing before him.
Oh,
Right.
Let me get out there first.
Let me get out of the way. I don't want to go after that dude. No, he's one of the greatest drummers in the world, really.
Yeah.
And but Manuel Valera is playing piano, monster piano player. So it's going to be a great show. Steve's headlining with Vital Information. That's the name of his group. You're hearing a little bit of that now. And Saturday night we're going to swing into the show with a group out of Richmond, keeping some regional talent on the festival.
Good.
Mike Hawkins and the Brotherhood, straight up down the pike swing jazz quartet, right? They're kicking it off Saturday night. And then the headliner is saxophonist Eric Marienthal. And Eric was the sax. I first heard Eric with Chick Corea's electric band, right? He was the saxophonist in that band. And he's really developed, he's one of the most versatile saxophonists playing today. He's well known in smooth jazz circles, funk, saxophone funk, like players like Everett Harp and all those guys, Gerald Albright. But he's a little bit more progressive in the sense of his versatility and what he does. This is him playing with Chick Corea's electric band, right? Eric Marienthal. Won a couple of Grammys.
Wow.
So we're excited to have him headlining Saturday night. Put together a great band with him. We're not bringing in a band, we're putting together a band using some.
So using all local people?
Mostly regional
regional
people, because I want to feature some of the area talent on the festival too.
Yeah.
And we have some great players here, and this is a chance for them to shine under that spotlight, and let people and introduce some of the area people to these guys. Let them know, hey, this is what's here in Hampton Roads. So 2 days of jazz, tickets at theamericantheater.org if you want to get them online. If you want to avoid Ticketmaster fees, which are ridiculous in my opinion, you can just buy the tickets at the box office. These shows aren't going to sell out. We're not trying to sell out. So you can come up to the box office and buy. The only slightly downside about it, we just don't have a gauge how many people are going to come.
How many people are going to show up and so forth.
If they buy the tickets at the box office.
So when you go out to look for this type of talent to bring to this area, are you connecting yet? I know it's really, really important to you that people don't lose jazz as a genre, and particularly in this area, that people know that they can hear great jazz right here.
Barbara, jazz has a problem, and that problem is identification. Because if you go out on the street and ask 10 people if they like jazz, and if they say, oh yeah, I like jazz, we say, well, name me some. Chances are 90% of the time they're going to name somebody dead. Right?
Yeah.
And I'm serious when I say it.
Yeah.
Oh, I love Miles Davis, or I love, me some Chick Corea, or I love,
Coltrane,
Yeah, Coltrane, right? They're all gone. So jazz is in, and we'll say Herbie Hancock.
Herbie's like, what, 85, 86, something like that. He's not going to be playing that much longer. Wynton Marsalis, you know, everybody knows Wynton. I joke with Wynton, call him the repeat offender because everybody keeps he keeps coming back year after year after year, you know, because we're down, jazz is down to names that people don't recognize, but it has nothing to do with talent. There's plenty of talent. So the point here, the bigger point is people that want to hear jazz have to start trusting the organizations that bring you the jazz. Say, I may not have heard of these artists, but I trust what Hampton Roads Jazz Incorporated is going to bring in jazz-wise. Right.
What else?
It's like the Virginia Arts Festival.
Yeah.
You know, people know that name, they trust that name, and you know, so.
Are you going to be there, Keith? I know you missed the jazz.
Well,
too.
actually, my wife's birthday is
this
well,
weekend.
you know what that means.
So
priorities.
Priorities. Absolutely.
I know where my place is going to be. So I actually am taking her out of town, so I'm gonna be gone all weekend. So yeah,
So-
I will
He'll be at the next one.
He'll be at the next one. So, what else are you doing in terms of education for folks too?
Well,
With
we
students, I know
have-
you're working with students, right?
Yeah, we're trying to, you know, if we can get like teachers to respond to our request. You know, we send out emails, hey, let your students know that this is going on or this is going on, you know, and simply trying to get people to respond to some of these things is you know, tricky. We are getting ready to plan we're going to do another jazz lecture series at the Hampton
great.
History
Yeah, that
Museum
was
in
fun.
February.
That was fun.
We're going to do it again. There's
That.
a lot of people ask about that. We brought in some great people to talk about this music and teach the Hampton Roads community about jazz. So education, jazz education, obviously a big part of our initiative.
And where is the Jay Center Trio? We were together just last week at the Eggleston 70th anniversary.
I already forgot about that because you know, so many other things. But
where the Jay Center Trio played, and I was the MC, and it was a wonderful event.
well, I'll be playing with the Latin Jazz Conspiracy, and I'll be playing with Eric Marienthal too. So you know,
that's great.
and with some great people, Mike Ely playing bass. Terry Burris, keyboards with Eric Marienthal. Then I'm taking some time and going to Europe.
Are you going to Europe for pleasure, or are you going to play?
I'm going to play a little
You're
bit,
gonna play
and
a
then,
little bit, and-
then for pleasure too.
Oh, that's
Yeah,
fantastic.
go hang out in those French and Swiss Alps.
All
for a
right, we
while.
got 15 seconds. Tell us again where to get tickets.
All right, the festival starts tomorrow night, Saturday night, American Theater in Hampton. You can get the tickets online at theamericantheater.org. And if you don't want to pay the Ticketmaster fees, just show up at the door, pay at the door. We're not going
All
to sell
right.
out. So
Thank
we're
you,
hoping to get
Jason.
150 to 200 per night, and we need about 60 more to do that per night.
Okay.
And we will get there.
Come on out and enjoy the jazz. Thanks so much, Jason. I appreciate
Thanks for having
it.
me, Barbara,
And
always.
Thank you for the honor of your company, audience, for this past hour. Check out this show again or any of our Another View programs at WHRO.org, on Spotify, or wherever you go for your podcast listening pleasure. Next week on Another View, a conversation that happens in many African American households when selecting a college, historically black college and university, or predominantly white institution. It's a conundrum. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Jordan Christie is our audio engineer, and Connor Worley answered our phones. I'm Barbara Ham Lee. Make it a wonderful weekend, everyone, and let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.